So I am presenting on prostate cancer in men ages 30 to 35. So prostate cancer is actually, next to skin cancer, one of the most common types of cancers. Luckily, it is one of also the most treatable cancers. Just so you guys know, all of us nurses, the prostate is the small gland. It kind of looks like a little walnut that resides kind of near the bladder, and it is what produces seminal fluid, which is very important for reproduction. Typically, when that happens, the symptoms start slowly. There'll be trouble urinating and decreased force of stream. There'll be blood in urine or semen. Sometimes there can even be bone pain, and there can be erectile dysfunction, which, as you can imagine, is very uncomfortable, especially if you're in your prime of 30 to 35 years old. So prostate cancer is screened for there are a lot of options. There's a prostate biopsy, which is essentially when they take a needle and they sort of just insert it into the prostate itself and then test the specimen that they get back. So that's one of the ways that they can test for it. Another is a prostate-specific antigen blood test. So what that does is they essentially just draw blood and they're testing for that prostate antigen that is found in your bloodstream. It's usually a small amount that they find, so it has to be a very sensitive test, but higher levels are found. It could also indicate a prostate infection or inflammation in the prostate, or it can mean that there's a cancer that is enlarged. And so it's not you can't find out just from that. There has to be more than just the PSA blood test. You can also do a digital rectal exam, which is probably not the favorite for diagnosing, if we're being honest, but you can feel a mass physically if a doctor goes in and has to do that, and so it's pretty helpful in that respect. And then you can do MRIs that will help so that you can see the actual tumor within the body that's not terribly invasive. And then there's also an ultrasound, which is specifically meant for prostate cancer. It's one of the things meant for prostate cancer. And you just essentially stick the probe into you and you can kind of take an ultrasound from there and get the results that you need for prostate cancer screening. So risk factors and prevention, like a lot of things in healthcare, essentially you need to make sure that you are at a correct weight. There needs to be a family history taken to understand how much prostate cancer plays a part in the family line. We don't know why exactly, but Black men are a lot more likely to get prostate cancer. So if you are treating a man who is of African descent, then that might be something, especially if they have a family history or are obese, that you might want to check for if they're symptomatic. Prevention is eating a healthy diet with fruits and vegetables, avoiding processed food and foods that aren't naturally grown, exercising frequently, maintaining a healthy weight, and discussing risk factors with a doctor. If there's anything in your history that would cause concern, then it's incredibly important that you address that sooner rather than later. Treatment for prostate cancer it varies. So you may not necessarily need immediate removal of the prostate cancer. You may have some time to make decisions. Typically, cancer of the prostate doesn't spread to other parts of the body, and so you can wait a little bit longer to see what your treatment options could be and decide what's best for you. You could do surgery to remove the prostate, which in some cases needs to happen depending on how big the tumor is. And those are just essentially, they make in small incisions in your abdomen to kind of help get to the prostate, or they could do, if they need to, if the tumor is big enough, a really long incision in the abdomen. It just sort of depends. Radiation therapy is another option, especially external beam radiation, and then they can also do brachytherapy. So those are two options that you can do, especially if the cancer is a little bit bigger. You could freeze and heat the prostate tissue, which is super interesting to me. You can do cryoablation, or you can do high-intensity focused ultrasound treatment, which is heating it to help kill the tissue. Hormone therapy is another thing you can do. There can be side effects to this, so it may or may not be a good option for whoever has the cancer. Chemotherapy is another option, as well as immunotherapy, which is essentially they engineer your cerebrolectal T or Provenge cells, and they use that to help treat the cancer. Fertility, this is one of the biggest differences between fertility or for men that have cancer ages 30 to 35 and the rest of the population is typically this is the age where men are trying to have children. And so it's encouraged that they have their sperm banked, or they can have semen directly removed from their testicles, and then their partner can be artificially inseminated later. Adoption or a male donor is also a viable option to make sure that the man is able to have children.